Hello, I'm Michelle Levander, Director of the USC Center for Health Journalism. Thanks for joining us today, and welcome to our Health Matters webinar covering coronavirus, the economy, or your health. All 50 states are reopening their economies after an unprecedented lockdown and an economic plunge not seen since the Great Depression. Officials have had to weigh the damage of shutting down to industry workers and families against the risk posed by COVID-19. As policy leaders weigh risks, Americans are taking things into their own hands. Many are heading back to work, but people are also relaxing their vigilance in their leisure time, gathering in large groups and at beaches and bars. Confirmed COVID-19 infections are soaring, with new outbreaks in states such as Arizona and Texas, pushing hospitals to their limits. In this webinar, we'll explore where we stand in the reopening and what's ahead with flu season and winter around the bend. We'll explore what policies and practices might reduce health risks and how journalists can tell urgent stories of workers and families forced to choose between their health and their economic survival. Here to help us explore these topics, we're joined by three distinguished speakers. Jim Tankersley, who covers economic and tax policy for the New York Times. His first book, The Riches of This Land, The Untold True Story of America's Middle Class, will be published in August. He has spent more than a decade covering politics and economics in Washington and has written extensively about the stagnation of the American middle class and the decline of economic opportunity in wide swaths of the country. Hae-Young Yoon is Senior Policy Director of the National Domestic Workers Union, an advocacy organization promoting the rights of domestic workers in the United States. Previously, she was the Deputy Program Director at the National Employment Law Project in New York City. And we'll also hear from Jan Gurley, MD, a writer, an internal medicine physician, and a public health leader. She works for the San Francisco Department of Public Health, where she's held a variety of roles. She currently works in the communicable disease and prevention arena during the pandemic, writing guidance on the city's responses as a special project advisor. From 2018, she was Director of Public Health Emergency Preparedness and Response for San Francisco. Dr. Gurley also has worked in the Department of Public Health as a practicing physician and the medical director of clinics serving communities disproportionately impacted by structural racism, homelessness, and trauma. This webinar series is offered thanks to the California Endowment, the Commonwealth Fund, and the National Institute for Healthcare Management Foundation, as well as by individual supporters like you. You could tweet about this webinar at the hashtag #CoveringCoronavirus. A word about our format today. We'll be hearing from our panelists first, and then we'll turn it over to our audience for questions. Because we have many people participating in this webinar, we'll ask you to write your questions in the control panel of GoToWebinar. And you can write us there too. I'm sorry, not GoToWebinar, of Zoom. We switched platforms. And you can write us there if you're experiencing technical problems as well. We'll be archiving this webinar at centerforhealthjournalism.org. And now let's turn to Jim. Jim, states are continuing their reopening projects even while dialing back a bit inconsistently amid surges. At this moment of flux, can you give us a broad overview of where we stand economically as a country and regionally in different parts of the country? And what are the broad measures such as unemployment and consumer spending telling us?
Yeah, it's a great question and a great place to start because we are going through sort of in fast motion what we often go through with recessions, but with really wild roller coasters here in the last month. Back in March, we shut down our economy basically to stop this or slow the spread of the virus, and that worked to suspend a lot of economic activity. We saw enormous contraction very quickly. We fell into a recession very fast. Starting in April, we began to come out of that. States started lifting restrictions. People started feeling better about getting out and walking around and spending money again. And so the economy started to come back. That was probably true until about the end of May. Starting in June, those reopening efforts sort of stagnated, depending on which data you're looking at. And in the last couple of weeks, they've turned around. We're starting to see a contraction again in economic activity, and that's entirely because of the virus. The virus has started to spread and spike again, and people are just not confident about going outside. And one thing that we are learning over the course of this fast motion response to the pandemic is that the virus is dictating a lot of the economic activity we see. When people are afraid to shop or afraid to dine out or afraid to do things, they are not doing it. And it doesn't really matter what the state restrictions are, even in places where reopening, so to speak, is still in place. We've seen a real drawdown in the amount of activity people have in those last few weeks.
Thank you, Jim. And to your point, Jan, as a public health expert, I want to ask you, as Jim was saying, the coronavirus is exacting an enormous toll on our economy. So for you as a public health official, how do you really think about, and how do others in your role think about just the price that we're paying for shelter in place, and how long we can sustain things, and how fast we should move ahead with our reopening?
So in a perfect world, which many of us strive for, one balances these competing priorities, understanding that they all have public health implications. I think of it as a medical model. When a patient has a serious diagnosis, we want to figure out if it's safe to go back to work after the treatment has done enough to improve things, but before the side effects of the treatment become so severe that we've outlasted the benefit of it. That helps me think about, and I think it's not just for me, but most public health officials are very aware that school is important for children, work is important for families, being able to eat is a crucial public health issue, and being able to escape domestic violence is a really important public health issue, not just for us as communities or the victims who suffer from it, but even the downstream generational effects when it is not dealt with. So these are huge public health issues. However, in a crisis, there are times when we have to make priority-based decisions, and FEMA even has a criteria for this. And their criteria spells out that life safety comes first, and preserving property and the economy and the environment comes later. Their criteria are actually life safety first, containing the emergency is second, and then life safety property is third. Implementing that, though, in the area where we're trying to come out of a life safety focused phase is really complicated. So we do try to balance it.
And you know, while public health officials and industry leaders have the luxury, I mean, maybe that's not quite a fair word, but the luxury of sitting at their desks and making, you know, these kind of decisions in a, you know, in the, you know, using the best modeling and so on and projections they have, the same may not be true for many sectors of our economy. Many employees and workers, whether they be, you know, a school teacher or a domestic worker, and they're facing some really difficult dilemmas. So, hey, Young, maybe you could talk about how domestic workers and caregivers who you represent can safely go back to work amid what is really a deepening pandemic. How do you practice social distancing when you care for a child or an elderly person? And what do these workers need to feel like they're not putting their lives at risk for their livelihoods?
Yeah, thank you, Michelle. So domestic workers, we represent 2.2 million domestic workers in this country who work as nannies, house cleaners, and caregivers for people with disabilities and aging seniors in their private homes. As you were saying, and as Jim was saying, this is a pandemic induced recession, right? That we've deliberately shut down the economy down, and as a result, when families stayed at home, we saw domestic workers experiencing sudden and devastating unemployment, in particular nannies and house cleaners, while home care workers, caregivers were going to work. We heard from caregivers that were overwhelmingly going to work without safety equipment, without masks and gloves. So domestic workers are low-wage workers. An average wage of a home care worker, she makes $16,000 a year. So as states are reopening their economy, domestic workers are experiencing the crisis of impossible choices. So nannies and house cleaners who are getting rehired by their previous employers or finding a new job they do want to go back, and they have to go back because they're working for low wages. They really experienced no safety nets during this crisis. So they need to go back to earn a living for themselves and support their families. But they're also feeling very, as you can imagine, uncertain and concerned about not just their own well-being, but the well-being of their families and those who they care for, right? And in this moment, we really don't have any guidance about how private employers like families and parents whose homes are somebody else's workplace. What are the safe measures to support these workers, these families, to rehire and for the workers to work in a safe measures?
Thank you, Hey Young. And this really brings me back to you, Jim. Hey Young is talking about some vulnerabilities for a pretty big sector of our economy in terms of some sorts of protections. Could you remind us of both the kinds of economic supports that Congress has passed so far, and when those benefits expire, and what that means for low wage workers that like the ones that Hey Young is talking about, who may never have been included in these benefits in the first place?
Yeah, no, this has been an unprecedented, and we toss that word around a lot right now with this pandemic, but it's really true, federal fiscal response to what's happened. Congress in March passed a raft of bills that spent about $3 trillion trying to keep the economy afloat. Did that in a bunch of different ways. We sent checks to individuals and families who earn up to $75,000 a year. We're up to $1,200 per individual and $500 per child. Then they passed an expanded unemployment benefit, which is really boosted consumer spending for a lot of people who have been thrown out of work. That gives you your regular unemployment benefit, which is usually no more than half of the wages you lost, plus $600 a week. So in practice, that ends up for a lot of low wage workers being as much or even more than they were earning before they were laid off. And then there was a variety of aid to business to try to encourage people to keep people on payrolls. So a small business lending programs run by the Federal Reserve, bailouts for airlines. All of those have added up to a extraordinary amount of fiscal support for people and companies in the recovery. But some of it's already run out, and more of it will run out soon if Congress doesn't act. The unemployment benefits expire at the end of July, and there's a really big debate in Congress about whether to extend them or modify them or just let them die. A lot of businesses have run to the end of their it's called PPP loans, and it's unclear what will now come along next to sustain their payrolls. So we have a lot of questions and a lot of potential for what economists call an income cliff, where people who had a certain amount of money coming in all of a sudden because of a policy deadline don't have that anymore.
And Jim, with your crystal ball, what do you think is happening, likely to happen out of Congress for these sectors that we already knew were unprotected and didn't benefit from these recovery efforts? And there's also been really widespread coverage of kind of questionable beneficiaries of some of these loans. Do you think some of this will really go toward the small business it was intended for? And then after you reply, let's go to you, Hey Young, because I see you had something to say too.
Yeah, I do think we were going to see a different kind of program. It's not exactly clear what to help small business. There were two big problems with the small business loan program when it rolled out. The first was there wasn't enough money for everybody who needed it. And the second was there was a system set up for distributing the finite amount of money that seemed to privilege businesses that had existing relationships with banks or other types of connections. And that leaves a lot of particularly minority-owned businesses behind. And I think one real theme of this economic shock is that it is communities of color and women who have suffered the most, who have been on the front lines of layoffs or forced to work the essential jobs of the pandemic. They have been hit hardest. And but on the flip side, like Black business owners appear to have struggled to access the program early on compared to white business owners. So all of that adds up to issues Congress is, I think, aware of and trying to address and sort of thinking about what comes next. But it's a real concern, and I think making sure that companies and workers can stay whole is a big multi-dimensional problem in these congressional committees, and adding in the sort of like just like you're saying, the disadvantaged industries and workers and what they particularly need to that equation has been tricky. I mean, it's just not something they have dealt with at this scale and this sort of speed before.
And Hey Young, you were going to add something as well.
Yeah, so just to kind of dial in a little bit in terms of the impact of the relief packages that were moved in Congress. So as Jim talked about, CARES Act, which was the last relief, and the centerpiece of that relief was the cash payment. But what ended up happening was that cash payment, Congress made a deliberate choice to exclude immigrant working families who are paying taxes. So those who are who are kind of going to work every day, growing our economy and paying taxes using what is called an ITIN, which is the independent tax ID number, they were deliberately excluded from getting that cash payment, which had an enormous impact on both low-wage working families, immigrant families. And so I think we really saw the impact of that deliberate choice to discriminate and exclude a certain segment of our working families who are, as Jim was saying, are essential workers, right? Who are going to work because they cannot telework, and they were going out to care for the loved ones of whether it is an elderly person with chronic illnesses or the children of other essential workers like healthcare providers, but they were excluded from that. And I think the other piece that's been a real a consequence is that because domestic workers, significant portion of domestic workers are undocumented, that they do not have access to free testing and treatment, right? And I think the unemployment is that it's great that we were able to get pandemic assistance program that was on top of what they traditionally get. But we also saw that for low wage workers who are working in precarious experiences like domestic workers, they were either not able to access because they don't have enough work history or because they were not able to access due to their lack of immigration status. So we know that we're all weathering the storm of coronavirus, but it's not, not everyone is getting the support and assistance they need to really survive through this, to get back onto, for our economy to function again.
And Jan, for those workers, those essential workers who have been working throughout the pandemic, and especially those on the front line, where are we with our latest understanding about both what's needed to protect those workers and just the availability of some of the basic protective equipment? I mean, we saw a lot in the news about people not having masks in healthcare settings. We're also talking about grocery store workers and of course the domestic workers that Hey Young represents. Where have we made some progress, and what are some of the gaps, and what is the science now telling us in this fast kind of evolving scientific understanding of COVID about what was enough and what wasn't for those workers to protect them?
Thank you for that, Michelle. It is a serious and important issue. And I believe embedded in that question is a huge issue around equity. There are several levels of protection. One of the biggest one is information. And so I've already seen in some of our questions, like what specifically are people supposed to do? There feels like sometimes that there's a lack of clear information about what you can do to protect yourself and your family. I mention that because there is a number of ways to find out what that information is that people may be interested in accessing. One is obviously the CDC guidance, the next is your own state guidance, the final is your local jurisdiction guidance, but some of them have not drilled down into all sectors of our workforce and our economy and the people it can impact. And some of them also vary from jurisdiction to jurisdiction, and those differences might be very interesting to people. We in San Francisco released a guidance for home cooks and home cleaners, and we realized in the process that we aggressively needed to reach out to the people who hire those workers also, because the power dynamic is not equal. And so I think protection is an equity issue for many people who are struggling to support their families and avoid getting sick. The science also tells us that this is a household-based disease, that when you get it, you are thinking not just about yourself, but your entire household, because we bring it indoors and we share it indoors. And indoors has a much higher risk than outdoors. We're also learning that workers have a unique vulnerability, because I think of it as though they are a funnel for all these different humans to come and share their germs with them if they're not telecommuting. And again, indoors is worse than outdoors. So there are definitely emerging hierarchies of risk. And then finally, I think there are serious issues that we all need to wrestle with, because we are still in areas of scarcity about whether or not actual personal protective equipment is an equity issue. So there are shortages of even now plexiglass for people to try and set up plastic dividers. There are shortages of all kinds of things that you can't make at home. Obviously, there are ways to try to distance people. But again, if you don't have the cooperation of the people you're trying to work with or serve, you're in a really difficult position, particularly in those shortages. And so I think that we really, as like a society, have to figure out how to better band together to protect all of us. There's no hard line. You can't actually protect yourself from this if we don't protect all of us. So the science in general is that there probably is a hierarchy of risk in different settings. We now refer to super spreading events, where there are certain factors that can make the virus move faster through groups. There's some debate about whether there actually are people who shed more virus. I don't know that that's a very useful conversation, and we don't have a lot of science around it. It's certainly extremely stigmatizing. But I think the idea of looking at events that could be super spreading and applying them to the workforce could be really useful as we make these difficult decisions.
And Jan, people on this webinar are joining us from all over the country. And certainly in San Francisco, there's a lot of agreement among public health officials and political leadership. But we've seen a lot of cases where public health officials have been in conflict with the political leadership in a county, for example, and also instances where public health officials who have imposed restrictions have come under a lot of pressure from just ordinary residents. So I'm wondering, for reporters in North Carolina or in, Georgia or whatever, what are some of the ways that they can assess, how robustly their public health department is addressing this? What's the standard to measure against at a time when the federal government has allocated a lot of authority to states and even counties? And if to take this down to a very granular level, you mentioned your county's drafting something for cooks. That's so specific. There may be other jurisdictions where far more sort of big picture stuff hasn't been developed. So what would be the way to just assess that as a journalist?
So I can suggest resources that people may want to compare and contrast, but I do feel like human interest stories are often so much more gripping to me and probably to the public. I mention that because, having faced the AIDS pandemic earlier in my career, I do think there's a point where our minds can't get around the fact that 130,000 is so much worse than 100,000 deaths. But issues like Rock Hudson, Magic Johnson, Ryan White, who is not a celebrity, they really, really grip the public consciousness. And I mention that because there are dry documents that are easy to access online that can be very useful, But taking those and going to someone and saying, how are you doing this in your small business that is struggling to clean homes, might actually be something that is a way to take those dry documents and apply it. And I mention that because every jurisdiction will have some form of guidance online, even if that guidance is go to the state, go to the CDC. But when you compare jurisdictions that may be taking a more aggressive approach, like New York or San Francisco, and you say, well, why is our jurisdiction different? All of the San Francisco guidances are available online, and some of them are laws and some of them are guidances, and they're under this thing called health officer directives. And I mention that because you may find some really, when you look at them, you may find some really interesting differences between what your state or your jurisdiction is doing versus what these other areas are doing, and say why. What was the thinking behind that? And what is the data behind that? Not just what is the thinking. So one of the examples is we have, I just mentioned our home cleaners guidance. We have a guidance that all the windows should be open and people should leave the home when they hire somebody to clean their house. Are people doing this nationwide? Do homeowners know about this who have the luxury of staying at home and hiring people to clean their home? I don't know. But it's the kind of guidance that may not be really sort of, people may not be widely aware of it, but the nuts and bolts of it may actually be interesting to some people. The other really useful document that should be fairly easy to get is every jurisdiction and state was required to have a pandemic plan. It's very dry, but it's supposed to spell out what was supposed to happen. And you may want to look at it and say, well, this is what you said was supposed to happen, and now this is what is happening. Can we talk about what the differences are where they exist? So those may be resources that people find useful.
Thank you, Jan. And hey, Young, let me turn back to you and just ask you, you talked about a sector that's really vulnerable. They're working in people's homes, which is already, quite an unregulated sector. What kind of safety nets do you think are most needed for domestic workers and other sort of first responder, essential kind of folks as the pandemic continues, and how likely do you think those changes might be in our current political climate? Hey, Young, can you hear us? Oh, good.
Can you hear me now?
Perfect, yes.
Great. So just to follow up on what Jen was saying, I just wanted to share that given the lack of guidance, consistent guidance for how to best protect workers going back to their respective workplaces and including private homes for domestic workers, I just wanted to say that we've also launched a simple checklist for both employers and workers, and that is found on our website. So I encourage people to take a look at that. And the purpose of was that we know that parents and families are working triple duty, right? Working, homeschooling, and parenting. And the checklist should be used as a guidance that can enable families get to the support they need, whether it's childcare or house cleaning, but in a most safe way for everyone that's involved. So I just want to say that. I think in terms of the question, Michelle, to what kind of safety nets that workers need in this moment, was that the question?
Yes, that's right.
So just to, as I was saying before, domestic workers are low-wage work. They're earning low wages without a safety net. I think this pandemic has really brought into sharp focus both the profound failings of our care system, but in terms of the failings of this economy and our nation, of not really providing the safety net for all working families so they can thrive in. And so I would say that in this moment, what we need for low-wage workers like domestic workers are increased pay, access to health care, and permanent paid sick days and paid leave. I think as Congress will be coming back from their recess to DC to negotiate the next relief package, what we're advocating for is domestic workers, along with other essential workers who really been at the front line of addressing the pandemic, should have increased protection and pay, right? So some of those increased protections include what we've been calling the hazard pay, to recognize the work that essential workers are doing through this pandemic. I think everyone should have access to free testing, treatment, including when vaccine is available. And I think just in terms of, we are right now experiencing how families are left to fend for themselves in terms of figuring out how to provide care for their loved ones, whether it's a child or a parent. That one of the things that we're advocating for as a part of the next relief package is provide family care for everyone, but beginning with the essential workers who have to leave home their kids or their loved ones to provide to go out and work. So that's some of the things that we're calling for. I think the other piece that's really important is that there has to be an immigrant inclusion of our relief and assistance that's provided. So that means providing for, if there is going to be another cash payment for all working families who are struggling, that should include all immigrant working families.
Thank you. And Jim, you've done quite a bit of storytelling around, what we're calling essential workers, but really people who've been not seen as so essential in the past. And what is your reporting telling you about how people are handling the lack of the kind of benefits and safety nets that Hey Young just described? Do you find that that people are going to work even though they're sick, or paying for Uber out of their own pockets so they're not taking a public bus? What are you seeing, and how are you reporting on all that?
Well, it's hard, in part because we have to be very careful about getting out and reporting. And early in the pandemic, it was sort of everything we did was on the phone. Now there is more getting out and actually talking to people in person, which is always better in my experience. But what we're finding based on surveys and conversations and data that the government's collecting is that people are having a really hard time, not surprisingly, and that the programs set up to help them are not always connecting. One of the very first things Congress did was, pass a paid leave program that was meant to help workers take time off if they got sick, or they needed to care for kids because their daycare was closed. We did follow-up surveys that found a very small fraction of workers had heard of it or had made use of it. The program has not been very successful for those reasons. And the administration narrowed it with some rulemakings as well. So it did not have that intended effect. Then if you look at survey data that the census is doing, you see that a lack of access to childcare is keeping a lot of particularly low income, non-white women out of the workforce because they just simply can't afford to or are unable to figure out what to do with their kids in order to go and do their jobs. So these stories are examples of hardship that individuals are suffering, but I think it's really important that we talk about how it is also a financial hardship in our entire economy. When we have people who are unable to go out and work and provide for their families and keep the sort of wheels of the economy rolling, that hurts everyone. And I talk to economists a lot who talk about you don't want to risk when you go to the grocery store that the person stocking the shelves is sick. You don't want to risk that the person serving you your meal, take out or dine out or whatever, is sick. And that's probably, that worry is certainly holding back activity across the economy too. So people at the sort of the lower paid rungs of the workforce are suffering and could suffer a lot more in the months to come, depending on what happens with policy and the expiration of benefits. But at the same, and they are suffering whether they've lost jobs, which millions have, or whether they are forced to put their health on the line in order to keep working and keep earning a paycheck. And so I think it is sort of the story of this recession recovery is the degree to which those risks and damages have been concentrated on people who don't have jobs that allow them to telework, which is lower income, non-white workers.
And Jim, if I could follow up on that, one of the things looking ahead that we're seeing is the whole question about returning to school. And I believe the American Academy of Pediatricians is recommending a return to school because of all the learning and developmental issues for kids. But one of the things that has to be sorted out is, what if you have a teacher who has diabetes and is over 60 and you have all those kids mingling? What about universities? So how are you tackling that story? And what advice might you have for reporters thinking about what's ahead?
I mean, this is one of those stories that where the local level is just, I think, just a gold mine of great stories. Every school district is having this conversation right now across the country, but they're coming to different conclusions for different reasons. And the stakes are high no matter what the decision is. If you keep kids in telelearning for another year, what we are seeing already in the data is pretty good evidence that lower income kids are being left behind and that all kids are losing knowledge. If you keep them from going to school, you put barriers up for workers to go back to work. But if you send them to school and make them, potential, you raise the potential of infection spreading, and you jeopardize the health of teachers and what. I mean, these are all really difficult questions, and I think difficult questions produce the best stories. Big policy debates with really human stakes, high human stakes to them. So my advice to reporters covering this is to aggressively start with what's happening in your backyard and then link it into the national policy. I mean, the President of the United States has made this a big issue this week, and that there is, I think, a real value in showing what his opinions and the debate among experts sort of at the federal level looks like on the ground.
And can I speak to that just a moment, Michelle?
Of course, yeah.
I did want to say, I started this by saying how important school is. I did want to add that I agree with Jim completely that the virus can control our economy. And similarly, the virus, if we don't control it, impacts our children. And that is separate from their risk of infection or their risk of bad outcomes. If there is an infection, which is relatively small, I mention that because in countries where we've seen people who've managed to get the levels down, these discussions can happen at a calmer pace and with more sense of what modifications make sense and an easier discussion around risk versus benefit. This infection, I think of it as, a lot of people talk about it as though it's a wildfire. Like there's an ember here, an ember there, and now it's burning out of control. I actually would encourage people to also think of it as being tidal. As in, once it starts rising, it is really hard to get it to recede. And in some places it is like a tsunami. And once it gets to a certain point, even if we tried to shelter in place, it will keep rising for weeks. There's a domino effect to it. So when we are struggling with these decisions, whether it's the economy or schools, we are struggling with how we respond when the tide is coming in. And that may distract us from getting the tide to recede. But this is where I think Jim and I are on exactly the same page about not just the impact at a local level, but how it ties back to larger issues, because we are truly all in this together.
Thank you. And we're going to turn in a moment to all of your questions. Some of you have already been putting questions in the question and answer panel of Zoom, so please continue to do that. But I just wanted to ask quickly all of our panelists if they want to offer up what they see as the next key stories. And for you, Hey Young, maybe just share a little bit about some of the kinds of dilemmas that you're hearing among your members that could really animate stories and help people to understand what risks they're facing and the kind of intimate contact that they often have with the people they work for. You're on mute, Hey Young.
Can you hear me?
Yes, perfect. Thank you.
Okay. Sorry about that. I'm having unstable internet connection today. Before I want to share out the first account stories of what domestic workers are experiencing through this pandemic, because we've been listening and surveying workers on a weekly basis. But I also wanted to just echo what Jim and Jen were saying in terms of the coverage, like what's missing. I feel like we've definitely saw the profound failings of our care economy, right? And there's been, as we were saying, that the parents and families are kind of left to fend for themselves, and just the enormous challenges and stake that we face, both at an individual family level, but as a community, as an economy, as a nation, right? I feel like there could be more coverage in talking about what are the, how low-wage working families are experiencing just the failings of their care system. We saw enormous amount of just the number of coronavirus deaths in the nursing home and long-term care facilities is just mind-boggling, right? 43% of all U.S. deaths are found in nursing homes and long-term care facilities of both patients and workers. But I feel like we just haven't focused. There's been some conversation around the underreporting of the impact and the deaths, but really talking about how is this impacting, right, in terms of in people's lives. I think digging into different regions, different communities, different sectors of our economy, I think would be really great. Because I think we all need to recognize both the stake that's at, and also bringing back to the role of the government in finding solutions for working families, right? So that we can all get some sense of normalcy back into our lives. I would say in terms of, I have to say, it's been really heart-wrenching to hear the stories of our workers, right? In the earlier on, as soon as shelter-in-place orders took effect, we heard again and again of domestic workers of how quickly they lost their jobs. So, for example, Maria, who's a 50-year-old house cleaner who had worked for 25 families cleaning their houses in Philadelphia, and she was earning about $1,000 a week, right? But she's undocumented, and she has been paying taxes for the last decade or so, right? Within days of shelter in place took effect, she got text messages from her clients saying, don't come to work because of coronavirus, right? And we'll see what happens. Those were the messages she got, and she just lost her job within a day, right? And when the CARES Act moved the relief package, she was carved out of that cash assistance, and she was not eligible for UI. So just the profound ways in which our the lack of safety net and our economy is not delivering for what people need, and the profound ways in which that people are falling through the cracks is really real, right? There was another time that we were doing webinars with our members, and one housekeeper literally picked up her phone and showed it to us saying she's got 5 cents in her bank account, right? So I think this level of suffering that we're seeing is something that should be covered more. I would just end by lastly, in terms of, we've been hearing from home care workers, caregivers, around just what they're struggling with. So we have a member in Texas. She used to have 3 clients, right? She lost 1 job, and she got her hours reduced with a 2nd client, and she was providing care for the 3rd, right? But she was going to work without any safety equipment because she was, this was earlier on in Texas, where she was saying that the masks and gloves are only available for quote unquote medical staff, right? And she said on one of the calls, she said her survivability is at question, right? And she talked about how she can try to practice social distancing while watching TV with her client, but how do you practice social distancing when you have to help your client take a bath, a bathe, for example, right? Help them get up in the morning and get dressed, right? So this is all the kind of challenges that we have to be thinking about as our economy functions back, right? Definitely. So I really encourage people to think about all the ways in which this public health crisis is affecting all sectors of our economy.
Thank you. And Jim or Jan, did you want to add any story ideas before we have a number of questions here too, but did you want to offer up an idea or two?
I have a couple. One of them, Michelle, is I know from being in public health emergency preparedness and response, that there is a phrase that should cause serious alarm in any community, and that is called crisis standards of care. And I'm not sure that has really entered the public consciousness sort of enough. It means that the usual standards of medical care have been suspended. And when that happens on American soil, honestly, that should be alarming news. And I know it is happening in several jurisdictions. So I'm not sure that is something that the general public is very aware of, but it's a phrase you want to look out for. Another thing that I think is really important is this definition of who's at risk and who's vulnerable. And part of the reason I raise it is the CDC refined it recently and expanded it. One of the things that people outside of this field of work may not realize is that those criteria are also often used by communities or jurisdictions to decide who gets first crack at a vaccine. So there can be debate in different communities about whether they're going to go with that list or they're going to have their own list, because they're aware that that will be how they prioritize who gets vaccines. And again, looking ahead, there are often plans for jurisdictions for what is called mass vax or mass vaccination campaigns or events. 2009, the H1N1 epidemic was probably the last time many jurisdictions did it, but that's something else, if you're thinking ahead, you may want to be thinking about. And then the last story idea I would throw out there is, I think we as a nation have honestly failed to adequately figure out how to sort of inoculate ourselves against divisiveness or a plague mentality. And I think one way that we can think about trying to do that, both for equity reasons and for overcoming this infection reasons, is to think about how to do more positive framing around efforts that are actually geared towards helping us survive. By that, I mean things like even the word shutdown has tremendous negative connotations. And so trying to figure out how we can say we're pulling together to save lives, but we need to support each other while we do it, is something that I think we're going to have to wrestle with. And we know this from other behavior change campaigns and other messaging campaigns, that we really need to figure out a way to frame positively efforts that result in behavior change. So those are some ideas I'd throw out.
And Jim, did you want to add an idea or two before we open this up, or?
I'll be super quick. I would just say two things. The first is they're both about ripple effects. The first is that we have started to see some job losses turn permanent. And I think there's a lot of really good stories in the question of who are the workers who are not going to be recalled to their jobs ever, whose jobs have just gone away for good. Where are the companies that are not going to reopen? What does that mean for a community to lose those jobs and those places to eat or those places to work or whatever? And there's just going to be a lot more of that in some surprising places, not just hospitality. The second thing is state and local budgets, which tax receipts have been crushed by the recession, and there are going to be layoffs almost certainly. They've already started. They will probably spread, and at a time when public health departments and schools and other places are really in need of doing a lot, there is going to be immense pressure on lawmakers to find places and budgets to cut, and those will be big stories as well.
Thank you. So now I'm going to turn to some of the questions from our audience, and just a reminder that there's a question and answer control panel where you can type your questions to. I'll start out with a question from Cheryl Perkins. She says, please share some of the best ways to remotely identify and contact individuals whose stories we may share, in as much as Jan said that personal stories are the best. And let me just say, Cheryl, that we also had a whole webinar on this that you can find in our archives called Street Reporting Without the Street. So if you just go to the webinars tab, you can find that too. But I know that our panelists will have some ideas as well.
So I am not someone who sources people, just saying that up front, but I did want to put in a plug for trying to find a diverse group of people to speak to and quote. I refer to sort of a whiteout or an all guy approach as ball hogging because I played a lot of basketball in the past. I think it's really important, and I know Michelle's group had done a previous look at the disproportionate number of men and probably white men that are being quoted and seen in the media these days. And for our communities that we're trying to serve, I think it's so important that they see representatives that are part of their community. So I put in a little plug for that.
And we have a question from Jamie Frazier, who says, in many places, public health officials have been reticent to leverage their full police powers to enforce mandates on communities or employers. Can you talk about how the voluntary compliance approach affects low-wage workers and their employers in particular? And anybody can answer this among the panelists.
Yeah, so that is this is Hayoung. Can you hear me?
Yeah.
Yeah, it's I appreciate the question. It's really challenging to think about a voluntary mode to get people protected in this moment. But, you know, I think there's sort of two perspectives on that we are taking the voluntary approach because we don't have standards and rules in place to enforce, right? And so absent that, we have to take the voluntary approach. I think the second perspective is that, as Jen was saying, like we're in this all together, right? That so much of our well-being is interconnected. And I think this is a really moment for everybody to say that in order for us to be safe, we have to be working together. And that's the spirit and intent behind our checklist, was to offer up this guidance for both workers and families and employers so that they could actually figure out how to make sense of that everyone in somebody's home, which is somebody's workplace, is safe, right? But I think the longer term, what we want is we need robust standards that allows for people to have rights and obligations that could be enforced. But we're really grappling in a country and an economy where we cannot have our federal health and safety agency to issue an emergency standard that's related to infectious disease, right? So that's the kind of the reality we're living under.
Can I also add, Michelle, that the health officer criteria is not the same in every state. In California, health officers are actually, they must be a physician. There's one for every county. Sometimes a city like Berkeley has chosen to have their own. They have actually 7 police powers, which are very old school, including the power to make people work unpaid and the power to confiscate things and the power to set a curfew. What we know, though, is that you cannot arrest your way out of behavior change. And even worse, communities of color, and we know this, and we've actually proven it again recently, are disproportionately affected by rules that are based on laws in a very negative way. So it becomes another triple whammy to a community that's already struggling. So that's part of the reason I was focusing on positive messaging and how we as a community and a nation, and especially through our media, try to encourage behavior change as opposed to trying to legislate things that are actually not uniformly applied and may not be possible when there's just enough refusal. How are you going to do this if the vast majority or a large section of your population? If you haven't done the groundwork of convincing people that this is important for themselves and their community and their loved ones, you can't and shouldn't try to arrest your way out of it.
Thank you. Really thoughtful reply. We have a question from Deidre Dara, who says, what realistic mitigation steps would you recommend given underfunding, understaffing as regards to disease containment, COVID testing, and contact tracing that will inevitably come to my setting? In a state with 529 school districts, there are that many opinions on how to safely return staff and students in a fluid, ever-evolving pandemic. I would appreciate your thoughts.
Can I just say quickly that this question gets to a really important failure that we've seen from the federal level, which is that we are still way behind on testing and a national strategy. If there's one thing that officials have been telling me over and over and over for the last 4 months now about, how do you get yourself out of a pandemic? It always comes back to testing, and we have more of it, but still not nearly enough. And all of these debates sort of get much easier to solve if there's a lot more testing. So that's my broad-based national response to a good local question.
I would add, Michelle and Jim, that testing is only useful if there's action after testing. So you can test an entire population, but if people cannot stay home, or they do not believe they should stay home, or they send their children to childcare because they're desperate even though they know their child is sick, testing is worthless. If you don't have testing, though, you don't even have the first step. You can't act on what you don't know. Otherwise, we are back to shelter in place. And the other thing to be aware of when it comes to testing is that testing was not meant to be done for an entire population. We don't have a centralized telecom workforce to do contact tracing on 100,000 people a day. So I think one of the challenges is getting this tidal nature of this pandemic low enough to where we can effectively use tools that we know will work to save the spread and prevent the spread and reduce the rate. But to get back to the person's question about all these different ways to do this and 500 plus opinions, I do think going to guidances that are thoughtfully written, often with community input around how best to do this, is a good place to start. This is only my personal idea, not the Dph's idea, but one thing I wish we could do more of is have community science groups, where maybe a school system decides to try one approach and actually tracks how they're doing and has more than one group of people. I think there are creative ways we could try to figure this out. I don't think we should have ever had to do this. I think when we have conflicting guidances across jurisdictions and across states, it does weirdly get to a kind of plague mentality where everybody has their own town and they're trying to figure it out. I don't think that works. It never has worked, not even in the Middle Ages. But the more we can share and innovate and track ourselves, the better we can try to protect ourselves as we pull together in this.
Thank you. And we have a final question from Penelope Overton, who says, could Jim talk about what second day or deeper dive stories are lurking in the new SBA PPP data above and beyond which politicians and big companies got these forgivable loans?
Oh man, it's like the questioner has been hanging out in my Slack discussions all morning. There's a lot. First off, the data are, sorry to get a little bit wonky here, but the data are weird and messy, and there's definitely errors in it, and that in and of itself could actually be a story that the government does not have a grand, reliable database in it, some of its top-line findings appear to have been wrong because of miscoding. But within that, I mean, I think there are big questions about who got the money, what states and industries and businesses were able to access money faster in the early days when the money was more limited. I think there's questions about who are the businesses that, you know, and industries that just didn't get money at all, even though there was money left over at the end. And you can use sort of mash up different data sets to look for that. And then I just also think that there are a variety of really interesting financial health barometers basically in here for your community. You can go in and look and see a large number of businesses that took it, who you might say, wow, yeah, that makes sense. That that particular restaurant group in my neighborhood absolutely was closed the entire time. But wait a second, those guys were open. They were open the whole time. It seemed like they were doing fine. You can call them and follow up. I mean, I just think there are, in the like, just in going through the Washington, D.C. data, which is where I'm based, there were some really fascinating, like, hey, why does this particular trade group, how are they suffering? Why do they need a loan here? And I think in those examples, I am very partial to big like data trend stories, but I also think in the examples in the database, beyond just sort of political horse trading, you can find a lot of really interesting questions about, you know, did the people who needed the money get it, and did people who didn't need the money take it anyway?
Thank you so much. And I want to thank all of our panelists for this really thoughtful discussion, and our audience for participating and their great questions. We will be sending everybody a survey shortly that asks you for your feedback on this session and your ideas for future ones. Please do weigh in, as it really helps us figure out where to go next as we try to help you with this webinar series. And please know that we'll be archiving this webinar on centerforhealthjournalism.org later today. And also just want to put in a plug for supporting this series. It's very simple to do. You can just send a text to 41444. We're doing all this really without a lot of extra support to serve our audiences, and we hope that you can help. And with that, I just want to thank everybody. Have a wonderful day, do some great stories, and we'll see you soon.
Thank you.
Thank you.
Thank you.
Thank you.